All right, hello, friends, family, and colleagues. This is Jean-Luc Neptune. My friends call me JL. I am a physician and an entrepreneur based here in New York City, and I'm making this video because I tested positive for COVID-19 today, and I wanted to share some knowledge and information because I've been getting tons and tons of questions about this from friends and would like to be useful in some way. So the first question is, how did I get tested? Which has been like the number one question. So I actually got tested on Monday, which is the 16th, and I got tested at One Medical. So One Medical is a concierge primary care clinic that's based here in New York. There are offices in San Francisco as well. I reached out to my doctor, Andrew Feta, on Sunday night and told him that I was having cough and that I had a confirmed exposure. I'll talk about that in a second. And they were able to hook it up for me almost instantly. I got an appointment on Monday, went down there, got swabbed. They sort of put like a swab in your nose, a little bit unpleasant, but quick enough. And then I got my result today. They called with the result, and that was very helpful. So One Medical is one of the vendors, and from what I understand, the state is ramping up testing in places like Staten Island, Long Island, and Rockland, and hopefully that stuff will be online soon because we really need testing to understand, what the situation is and how we need to treat people. Second question related to that is, do I need to be tested? A very common question that I've gotten from friends. And from my doctor, what he said is that essentially if you don't have symptoms and you don't have an exposure, you cannot get a test. I think even if you have symptoms, unless you have a confirmed exposure, you can't be tested either. And I think honestly, we're probably getting to the point where so many people are going to be infected that the testing is just going to be an afterthought. They're going to assume that you have COVID, and I think what we're doing now in terms of isolating people is the plan for that. And I think we're going to have pretty far-reaching isolation, either mandated by the city or the state or the feds at some point soon. Third question is, what is the syndrome like? So I came down, I fell sick or fell ill on Tuesday the 10th, and I've pretty much been laid up since then. So, I wouldn't say I've been bedridden, but I've definitely been bed proximate for more than a week. It started off really with fever and chills and fatigue. It just felt like a cold, maybe like the flu. I get the flu shot every year, but I thought maybe this was like a strain of flu that wasn't covered. Really didn't start coughing until Friday or so. And then, the cough persisted into the weekend. And then on this Sunday morning, I got an email notifying me that someone at a conference that I spoke to on March the 7th actually was positive for COVID. And if you can imagine what the subject of that conference was, it was telemedicine approaches for the future in medicine. And the audience was 50 French healthcare executives, which in retrospect seems totally crazy. But at that time, we weren't so worried about that. I've been feeling better over the last couple of days, but I still have low-grade fever, still coughing a little bit, as you can tell. Another question that I've gotten is, what's my regimen? So I've been keeping it really simple. Again, I'm a physician speaking, so please don't take this as medical advice. Ask your doctor if you have any questions. But Tylenol has been the core of my treatment. Tylenol helps keep the fever down, either 500 or 1,000. I got a lot of pain in my ribs from coughing, so that's helpful there too. There's some reports out of France that say you should avoid anti-inflammatories like ibuprofen. So I would be careful in terms of those medications. Again, do your own research, talk to your doctor. To help suppress the cough, I've been taking what's in the most common Robitussin formulation, which is dextromethorphan and guaifenesin. Dextromethorphan is the cough suppressant, and guaifenesin sort of breaks up the mucus in the cough. And then finally, it's also peak allergy season. So not only is it COVID season, but we're coming to the end of very bad flu season, and it's also allergy season. So I've had a little bit of wheezing. So I've taken some cetirizine, which is Zyrtec, and that's helped a little bit there too. In terms of last question, a lot of people have asked, what should they be doing? The key thing I'd say is like, this is not a joke. This is not mild. This is not like a mild cold. This is not like something you ever had before. This is really rough. And again, I'm lucky that I'm in pretty good health. So I knock on wood, have gotten through the worst of it. But I think, the smart thing to do for most people is to be serious about isolating as much as you can, as much as your work and family responsibilities allow you to do so. Even if you're a young person, do not assume that you can't get this. I saw some data that showed that like 50% of people in ICUs in the United States who are showing up are less than 50 years old or something like that. Use hygienic precautions, wash your hands all the time, use antimicrobial gel, use a mask, use gloves if necessary. And again, just try to be cautious, try not to be cavalier about this, because I think the more we can suppress the spread, the person-to-person spread of this virus, the more quickly we can snuff it out, or at least slow it down, so we can give our healthcare people a chance to catch up. So this is Jean-Luc Neptune coming at you. Probably one of the, I wouldn't say the first persons, but probably one of the first few thousand people tested positive for coronavirus here in New York. If you have any questions, please let me know. Drop a question in the comment box. Again, this is all for informational purposes only. If I can figure out a way to to do a live stream or an AMA, if people have any questions, I'm happy to do so. But please be safe, please be careful. Best of health, and hopefully we can make this together, make this through